All right. Okay, hello class. I'm Shayna Harrison, and Allison Smith and I are presenting the in vivo for long-term care. The scenario we were given, I will just read it out for you guys. Your parents are caregivers to your elderly, mentally handicapped uncle. He fell and broke his hip. He is currently in the hospital, but will be released soon, and your parents will no longer be able to fully care for him at home. Because you are a healthcare administration major, your parents need your help to find the right long-term care facility for your uncle. Find and contact at least 2 facilities that can offer the appropriate care for an elderly man that needs therapy for his hip, as well as help with medications, food, and hygiene. Obtain all of the cost and care information needed to make your decision. So first off, with Medicare patients, they have to have a qualifying hospital stay. So this means that they have to stay 3 days in the hospital before they're allowed to enter a skilled nursing facility. And the time they spend as an outpatient or under observation in the hospital actually doesn't count towards the 3 days. So they have to be admitted as an inpatient for 3 or more consecutive days. And that doesn't include the day they're discharged. So that gets kind of confusing for people. And then Medicare will cover up to 100 days if you meet the requirements. And then there's a link right here to a Medicare skilled nursing facility booklet. I found this on the Medicare.gov website, and it's published, I think it's like 2007, so it might be a little bit dated, but there's lots of information in here if you guys want to look that over. Okay, so the first one I visited was Mother Whole Home here in Kearney, Nebraska. It's a 58-bed skilled nursing facility. They offer physical therapy, occupational therapy, and speech therapies. In this scenario, our uncle would need physical and probably occupational. They also provide 24-hour care, and that includes the state requirement of at least 8 hours a day of registered nurse coverage. Here, the residents do not typically pay anything while staying under Medicare, and most of their residents are Medicare. There's the business card of the administrator that I spoke to. The payer mix here, the majority are Medicare recipients who pay 0 out-of-pocket costs. A private pay patient could expect to see a daily base rate of $230 in addition to varying charges based on the level of care they need. This typically amounts to an average monthly rate of $6,000 to $7,000 a month if you were a private pay patient. The second one that I contacted is Mount Carmel Home, also in Kearney. A 75-bed nonprofit skilled nursing facility. They offer physical, occupational, and speech therapies again. They also provide the same 24-hour care, 8 hours of RN coverage. Another thing they offer here at Mount Carmel Home that I found pretty interesting was this transition room, but this is a space that's only offered to private pay residents to be surrounded by their family as they transition from earth to heaven. And I got this booklet about it. There's like a really nice custom bathroom. There's a fold-out bed for family members. Yeah, kind of just a really special sacred space they have. So that's kind of interesting. But it's also sort of strange that it's only offered to private pay. And I wanted to talk to them more about that, but I didn't. But the payer mix at Mount Carmel Home, they're actually 60% Medicaid, 40% private, and 10% Medicare. Their rates range from $160 to $280 a day. And again, same thing with Medicare, as long as the resident meets the qualifying hospital stay and continues to improve and stays within the requirements, the payment will be 0 for the 100 days. I'm recording this, get out. Sorry. This website's pretty interesting. It's a Medicare Compare website. So here's the link. You can compare facilities when you're trying to choose one for your loved ones. You can view prior inspection reports, fines, and ratings for staffing, health inspections, and quality measures. And Mount Carmel, let me pull this up. I found their inspection report, and I just wanted to share a few things from here. So one thing I found interesting, I had no idea about this, but they actually are required to knock on the residents' doors and introduce themselves prior to entering their rooms. They failed to do this for a few rooms, so they got docked points, I guess, on that. And then another interesting one was Observation 10:15 a.m. Resident 38 in a wheelchair sitting and facing the window in the resident's room. The bed was behind the resident. A blue cloth soaker pad, a pad used for incontinence, was laying on top of the bedspread. This was visible from the hallway. So it was interesting that I just didn't know that such care was taken to protect the dignity of these residents when they're in these facilities. I just thought that was really interesting. There's a lot of things I didn't know that you would have to, I guess, abide by as an administrator in one of these facilities. There was also other things, especially in the food department, where they didn't date containers that were open. They didn't perform hand washing for the required amount of time, touching things while they were cleaning them. Anyways, it just seemed pretty strict, which I didn't really realize all that work went into it. So I thought that was interesting. But you can go to this website and type in your zip code, and it'll pull up all the ones around you that you can compare and contrast. And Allison, I'll let you take it over.
Yes. Thank you. I also interviewed two facilities. And the first one is called Elmcroft of Shippensburg. It's my hometown here in Pennsylvania. And it's a 60-bed for-profit organization. And because it's for-profit, they try to make it seem more of like a resort type feel. And they try to, like, none of the aides wear the scrubs. Instead, they wear like a polo shirt and like khaki pants. And they try to make it seem not like a nursing home. And that's kind of their goal, is to make people feel like they're in more of a nicer place than a nursing home. And so they do not have therapy offered there. It is an assisted living, not a skilled nursing. And because of that, they have a room where outpatient therapy can happen, where the therapist will come in, or they can go to their rooms and do the therapy. Also, these aides are not the skilled nurses. They are certified medical technicians, and they're also certified in CPR and first aid. And it really is, as I was talking to her about if I had an uncle who had a hip problem, she said that because they, or it shows on the next slide, actually, if we can go to the next slide on this, yes, there it is, that because they are a strictly paid, facility, strictly private pay, they do not have the requirements that they need to see in the hospital that they do for Medicaid and stuff. So for the prices and payer mix at Elmcroft, you can see that they have different rooms there. So for a shared room, it's $120 per day. For a personal room, it's $180 a day. For a 2-bedroom suite, it's $230 per day. So the prices are a little bit lower, but that is kind of seen because it is a strictly private pay. So they do not have the lower amounts that they would receive from offering Medicaid or Medicare to pay for those rooms. They did say that many of the residents are veterans, and they use their benefits to pay for their rooms, and that's how many of their residents are veterans for that reason. It was a nice facility, but at the same time, I wasn't sure if it would be the right for the situation. And so actually across the street from that facility is there another one called Shippensburg Healthcare Center. And it's bigger. It's a 131-bed skilled nursing facility. And it offers long-term and short-term rehabilitation care. And it offers so many amenities, especially for therapy. Like the main ones are occupational, physical, and speech therapy that it offers. And definitely our uncle in this situation would need the occupational and physical therapy. The prices are a bit higher. It's $250 for a semi-private room and $290 for a private room. But because it says most residents use the Medicare or Medicaid to pay for it, that very few actually pay that full price. And then if they do not have Medicare or Medicaid, there is a program that they'll work with them and with their insurance to help them find the price that either they or their family are able to make. So not there. So for our choice, I know for my personal choice, I chose the Shippensburg Healthcare Center because it offered more therapy and more amenities. It also offered the Medicare, which is most likely what's going to be used for our uncle. And Shayna, do you want to go over your choice?
Yeah, so I chose Mount Carmel. They were just really helpful in answering my questions, seemed really knowledgeable and passionate about their facility. First impressions are important to me, and Mount Carmel definitely passed the first impressions one. It was brighter, it was cleaner. The Mother Hull home was a little bit dingy. Like you walked in and it was just really dark, sort of like dark tunnels. I don't know, it just wasn't very appealing. So I chose Mount Carmel for this one, even though their inspection had a few not so great things, but overall, I did like them a little better.
Thanks. I also know, just kind of going on what Tina said, when I actually worked in the assisted living a few years back, one thing that they said was to really watch the smell, because something people look for when they walk in is if it smells. And if it smells like it hasn't been upkept, if it smells like you're an adult, to just walk out and not put your family member there, because that means they don't take care of their facility. So that first impression really is important. I will read the questions real quick for you guys to answer. First, have you had to make a long-term or skilled nursing decision for a family member? If so, was the process easy, or did you find it to be confusing or hard to understand? Second, using the Medicare Care Compare website, find 2 local facilities and compare and contrast. What did you find? And third, as a healthcare administration major, are you interested in pursuing a career in long-term facilities? Why or why not? And lastly, you will find our references. Thank you very much.
Yep, there you go. We look forward to reading your comments. Thanks, guys.